Good morning. It's 10 o'clock. I'm going to give it a few more minutes because I see people are still joining us. So please bear with us, and we'll start in about 2 minutes. Thank you. Thanks for joining us for our webinar this morning. We're going to wait one more minute as people are still signing on, and then we will begin. Thank you. Good morning. This is John Gallagher. I'm the Director of Communication and Development for the Washington Health Alliance. Thank you all for joining me this morning for a demonstration of the new Community Checkup website. My goal today is to walk you through the website to illustrate its functionality for you so that you'll be able to make the most of it when you are on the site and to answer any questions that you may have. I'd like to begin with just a little bit of a background about the site and the process that we use to get to it. The purpose of the Community Checkup website is to make available to the public information about quality and value of healthcare in our state. It's also to present the results for the statewide common measure set. We stratify the information so it allows different stakeholders to use it in different ways. It allows providers to understand their performance compared to those of their peers. It helps purchasers to make decisions about their benefit design strategies, and it provides consumers with objective information that they can use to help in choosing a medical home for their care. The version of the website that's online now is the fourth version of the Community Checkup website. We issued our first Community Checkup report in 2008. The information available online now is for our 10th report. We've had 3 previous iterations of our Community Checkup website. Each iteration increased functionality and user friendliness. But even with those improvements, there was still a lot of room to do better. So previous versions of our website were largely static. You had limited ability to compare among entities. You couldn't really compare across entities, such as counties and clinics at the same time. You had no ability to choose which measures to see in comparisons. There were really no visualizations. There was 1 year's worth of data available, and reports were available only as PDFs. All of these issues are addressed on the new website. So with that, I'd like to switch over to the Community Checkup website, which you should be now viewing on your screens. The URL is www.wacommunitycheckup.org, as it has been in the past. What you're going to see, the tour that I'm about to give you is going to look at the different parts of the website, the different navigations, and what you can do with the information that's available online. I do want to note that at present, everyone is in listen-only mode. If you do have questions, please submit them online in the box that's available, and I will answer them as we go along. So this is the homepage of the Community Checkup website. The website was organized around three basic principles: to learn, to compare, and to find. So to learn about the basic concept of variation in healthcare, which is an ongoing theme in our reporting. To compare different facilities, different organizations, different geographies, so that you could see how quality results looked like across different entities. And to find, and that's really for consumers, to find information that would help them choose a medical home that would best fit their needs. And you'll see each of these three principles illustrated on the home page of the Community Checkup. So right at the beginning, variation healthcare theme, this is learning. This is meant to educate people about why variation in healthcare is a problem. We already have some pre-populated examples for people to look at and some language to help people understand why it's an issue and why it's important to them. But right away, you have the ability to jump into comparing scores. So on the home page, you can choose a facility type. Let's say we're going to look at a clinic, and we can enter that clinic's name right here. So let's just go with Polyclinic Downtown. I can actually type in another facility here to do comparisons. Let's say I want to look at PacMed on First Hill. I can keep adding facility names here to do comparisons. We're going to get to the compare score page in a moment, and I don't want to steal my own thunder, but this is an opportunity for you right at the beginning to get to the facilities comparison immediately without having to go even any further than the home page. You can look up care by an individual facility as well. So if you just want to look at, for example, Kittitas, Valley Family Health Medicine, in Ellensburg, you'll see that there's an autofill thing here drawing from our database and fills it in as you begin typing the first few letters of the facility's name. On the left side here, under Find Quality Care, this is a particularly helpful tool for consumers. This is meant to allow consumers to choose a medical home based on their own needs. So let's click on this. It's going to ask me if I'm looking for care at a particular clinic or a hospital. Let's assume a clinic. I click Next. And it's going to ask me what care I am interested in. Am I interested in managing medications? Am I interested in preventive care? Are there different conditions that I'm interested in? And also ask you about patient experience and potentially avoidable care, so avoiding waste in care. These are automatically checked because we think that people should be getting this information. It's important for them in considering where they should be shooting for their care. Let's just say I'm only really interested in diabetes and low back pain. So I click on those two examples and click Done, and it's going to take me to a page with the results where I can select exactly by zip code and with radius what I'm looking for. Now, I happen to live not in Auburn, but in Seattle, 981 833. I can select that here, and on a map with a 5-mile radius within that zip code, it will show me all the results for the clinics in that area and their performance on the measures that matter most to me. We felt that this was important information for consumers to have because it helped narrow down the information that had been on the Community Checkup website in a way that made it much more usable for them. The analogy that I like to use is that previously we had taken consumers to the end of this giant data lake and told them that the glass of water they wanted was somewhere within it. And now with this tool, essentially what we're doing is, with just a couple of simple steps, allowing consumers to get to the glass of water that meets their needs. So I'm going to go back now to the home page and just point out a few more things here. We wanted to give some prominent real estate to Healthier Washington because we are hosting the Common Measure Set results on the website, and also to the Own Your Health campaign. That is the Alliance's consumer education campaign, which really serves as an adjunct to the Community Checkup website to help educate people about how they can manage their own health and healthcare better. Let's go up to the top navigation now. Scores is really the heart of the website. And I didn't mention, and should right now, that all of our scores and dashboards are being driven by Tableau. Tableau is the engine that runs our website. Our use of Tableau is fairly unique in that we're not embedding individual dashboards, but Tableau is drawing upon our rich database to create dashboards as people are seeking the information. As you'll see, scores are sorted in many different ways so that you can get to the information in a variety of ways that best meets your needs. You can look at things by organizational type, so by clinics, by medical groups, hospitals, or health plans. You can look at results by geography, counties, accountable communities of health, or statewide results. You can look at measures by category. We have grouped things by category to make it easier for people to see a whole series of results that relate to things that they're most interested in. Or you can look at individual measures. So for example, if we look at category measures, if I just click on that now, this is the list of categories that we have available on the website. Some of this information, some of the measures are in multiple categories. So for example, for managing medications, there's generic prescription fill rates in there. The individual medications are going to be cross-referenced in other categories where they're appropriate. So the use of antidepressants, generic antidepressants, will also be in the behavioral health category. I've mentioned several times the common measure set. The full list of statewide scores is available through here. We call this the A to Z measure list, and you will see icons indicating when they are common measure set results, and you'll notice that most of the measures on the website actually are common measure set results. There are a few that are not, but for the large part, they are in common measure set results. So these are all the statewide results in a single table. I've pointed out on the home page the ability to enter a medical group name. There's an autofill that begins, and you can complete that. It works here the same way. You can enter multiple medical groups, clinics, hospitals, plans, and do comparisons that way. But what I want to show you here actually is this hyperlink, compare performance. this compare results hyperlink is really the treasure chest of all the data available on the Community Checkup website. When you click on this, which I just did, what you'll find is literally every result for every entity on the Community Checkup website. So this is basically the encyclopedia of results. It's by state, it's by ACH, it's by county. It will be by medical group. Every single measure in this report, in the Community Checkup, is going to be included when you click on that. It's this left-hand navigation that allows you to narrow it down. So let's say right now, you'll see here, what would you like to compare? And you'll click on this all, and you'll see literally everything is checked. Now, I may want to look at everything by every entity, but I may not want to look at it by every category. I may only want to look, for example, at the diabetes results by category. And you'll see there's a long list of categories here that we saw before. All I have to do is unclick all, click diabetes, and click apply. And what happens is the dashboard filters for only those results. So what we're looking at now is diabetes results for every entity in the state. Health plans, ACHs, counties, medical groups, clinics. Now, this is still, as you might imagine, a pretty long list. Now, let's say I'm only interested in not health plans results and not hospital results or state or county results. I may only want to look at results for ACHs and clinics. So I just unclick all, click the two entities that I'm interested in, and select apply. I would like to point out, I hope you notice that we have pretty zippy response on the website, considering the rich database that this is drawing from. It's a very quick response rate to get to the individual dashboards. So now what we're looking at are only results for diabetes by ACHs and by clinics. I can narrow this down further if I want. I may only want to look at HbA1c testing. I don't really, that's what I want to drill down on. So unselect all, select HbA1c testing, apply. And that's going to filter out the other results. I may only want to look at one particular accountable community of health. I may only want to look at the results for Better Health Together. So unselect all, select apply, and I'm going to see here the results for Better Health Together. And for the clinics that are in Better Health Together's within that ACH. It's going to filter it so I see only the clinics related to that ACH. I will note that this works only for clinics. It does not work for medical groups within ACHs because medical groups span borders. They are across ACHs. But for clinics, we can locate the clinic within the ACH and pair the ACH's results with the clinic's results. So you can see specifically to that location what the performance is around these measures. You'll note here at the top of this dashboard that we're looking at commercial results right now. Commercial results are the default, but you can switch and look at Medicaid results just by clicking on that button, and you'll see the results for Medicaid. Also, the default is to look at things as a table using our simple word symbol iconography. When you hover above the iconography, you'll get detailed information with the number of patients, the state average, and the confidence interval. But I may actually want to look at things in graph format. And thanks to Tableau, we're able to do that now. So all I do is click on graph, and I get a different view of these results with a little additional information. What you see is this dark bar is the state average, but you're also seeing a gold bar here, and the gold bar indicates the national 90th percentile. Where there are national benchmarks, our preference is to show those, because our goal as an organization is that providers in the state will be in the top 10% of performance nationally. And so with this addition on the website, which is new, we're able to see how far we get, how close we are to that goal. I'm having someone ask a question as whether or not I'm showing things in real time or in data, or there's a lag. This is real time. Things refresh really rapidly on the website. So let's go back to the table. And one other thing to show here, which is new to the this website, is that you can look at previous year's data. In the past, when we refreshed the data with the new report, previous year's data vanished. But now we have 2 years worth of data, and we'll keep adding to this as we go on. So you can look at 2015 data if you wish and see what those results look like as well. This dashboard is the most robust dashboard on the website. It really allows you the opportunity to slice and dice the data in many different ways, depending on your interests. It allows you to compare across organizations, as I've shown with this demonstration. It allows you to narrow down results in a way that makes sense for you. These are all new features to the website, which we previously did not have. And we think this is actually a great advance for our users to be able to work with the data results in a way that best meets their needs. So let's just go back to the scores page really quickly here. We looked at A to Z results. We looked at individual measure results, or measures by category results. You can also look at individual measures as well. So let's say I want to look at HbA1c testing. When I click on that page, I actually you'll see a little map up in the corner. And this little box, which is a headline box. Essentially, this tells you for those, for the clinics in the state, medical groups in the state, what the performance is. 38 of them actually exceed the state average on this measure, the state average being 90%, 224 are average, 9 are worse, and for those results where we do not have enough to publicly report, those groups are unrated. And I will note that on all of our dashboards, the default is to hide where there are not enough results to report. But if you want, you can uncheck that box, and you'll see all the results. So we're looking at the HbA1c results. Here they are by place, by individual places. You can see overall how people are doing. But I may want to narrow it down, excuse me, to a particular county. I might just want to look at results for Pierce County. And what you noticed is that the results below changed automatically. So we can see the scores for Pierce County clinics. You'll notice hyperlinks for places or organizations within all of these tables. Now, you can access the results for those organizations by going to the individual clinic pages, or if I'm saying, well, I'm really interested in Multicare Allenmore, I can click on that. I'm sorry, I went to the wrong table. Let's go back to scores. Let's go back to compare performance. For highlights here, for say King County, I can click on that and hit the place or organizational name. I apologize for that. And you'll see the results for King County. You can do this for the county. You can do this for the ACHs, medical groups, hospitals. They're all accessible through that Compare Scores dashboard. One of the things that we wanted to do on these pages was to call out good performance. So at the top of each of these entity pages, we note where the county or ACH or medical group is performing above the state average, where they have better scores. As an acknowledgement of how they're doing. One thing to note is that nobody is good at everything, and that the majority of the entities here actually do have at least one better score that we can call out. I have a question here. Does the map show any data when hovering over an individual county? When you're looking at the map, the pages for the individual measure, the answer to that is no. You don't actually see when you hover over that page, over a county on a map. There's also a question about how come some things are listed as better at 94% and others are listed as average at 95%. And that actually has to do with how we calculate our scores. So it depends upon the confidence interval. To be reported as better, the results for the entity have to be entirely above the state average. So if the confidence interval is entirely above the state average, then the score is better. If the confidence interval is entirely below the state average, then the result is worse. But if it straddles average, so some of it is a better, but some of it is average, then it is listed as average. So you'll sometimes see a 1 or 2 percentage point difference between results, whereas one entity will be noted as better, and another with a similar score will be noted as average, but it has to do with the confidence interval. So to be reported as better, your results have to be entirely above the confidence interval. I think that answers the questions that I've gotten online so far. Let me show you some of the other details that are available on the Community Checkup website right now. We have a section called Highlights. Highlights are really little stories of notable data that we wanted to call out and that we are adding on an ongoing basis. So you'll see a few of them here that are populated: HPV vaccination rates, healthcare spending, variation healthcare, opioids, measuring health plans. We are planning to add to these on a monthly basis so that there'll be continually updated content. Let's just look at the HPV in Washington State highlights so you get a sense of what that is about. The highlights are always preceded with a little bit of text as context to explain what the issue is. and what the key findings are. And then there is a dashboard that shows you results. So what we're looking at now are HPV vaccination rates for adolescent boys by ACH and by county. That's the units of measurements that are available for this particular measure. So you can see where performance is above the state average, the black bar being the state average, and where it's below the state average. And by clicking on this button, you'll see it moves to the rate for adolescent girls. These are really just noteworthy pieces of data that we wanted to call out, as opposed to having them just contained within the vast amount of data on the website. Understanding healthcare variation gives you another format and gives you a different way of looking at the data. So here we're looking at abacus charts. You can select different categories to see what the variation is. But one of the common themes in the Community Checkup website, in the Community Checkup reports, has been that there is a tremendous amount of variation about in healthcare for commonly accepted evidence-based measures. So what we're looking at now, a lot of this has to do with generic prescribing rates, but we're also looking at monitoring patients on high blood pressure medications. You'll note here we actually have a national 90th percentile benchmark. A good number of medical groups are above that benchmark, and a fair number of medical groups are below it. And the cool thing about this particular chart is that when you hover over an individual dot, you can see the name of the clinic and their performance. Each of these dots represents a medical group, and you can see the medical group's results and the high performer. And you can change it to look at Medicaid results. There are more limited number related to that for cardiovascular disease. Or you can change it to look at other categories of care, such as diabetes. And you'll note that even for as basic a measure as HbA1c testing, which everyone agrees is a fundamental element of care for people with diabetes, there is still a tremendous amount of variation. The state average is 90%. The national 90th percentile is 94%. But there are individual medical groups that perform above that 94% benchmark. I have a question here is why is there no bar on the HPV for national average comparison? And that is actually where there are benchmarks to use, we make them available. Those are HEDIS measures, but not every measure on the website has the national 90th percentile. Many of them do related to HEDIS measures, but not all of them. And that is why not everything has that gold bar that you can measure against. Let's look at reports on the Community Checkup website now. In the past, we've always had our reports available as PDFs that you can download and print out. And you'll see here by category a long list of our previous reports, which are downloadable as PDFs. Not just our Community Checkup reports, but disparities in care, our reports on patient experience. But for the first time, we are actually providing reports as web pages. So if you go to View Report, this is essentially the printed version of the Community Checkup report, but with an additional refinement that actually makes it much more fun to use. So you'll see here on the left-hand side, basically a table of contents where you can go to the section that's of interest to you. So let's go to behavioral health. It takes you immediately to that section, and you'll see tables related to that. But you'll also see the same maps that are in the printed report, but now they are interactive. So we're looking now at a map related to staying on antidepressant medications, but we can change that. We want to look at mental health services for adults. So all we do is click on that measure and we see a different set of results related to mental health services. This really allows you to interact much more with the charts as opposed to just looking at static charts in the printed report, which are helpful, but these are actually more fun to use. These results are also available by ACH, and this filter, these results change as the filter on the top changes as well. You'll see this across the entire report. So we're looking here at well child visits. Again, you can hover and see the individual medical groups' names here. You can look at Medicaid results and see how far we have to go to achieve a national top 10% of performance. Our goal is going forward with all of our reports that they will be in this web format as well as a downloadable PDF format, because that will allow people to interact with the reports in a way that they're not able to by just looking at the PDF. I'm going to move now to topics. The Community Checkup website is not really structured for the general consumer. In creating the website, we looked at who we thought would be using it as a consumer, and we believe it's more of a consumer reports type of reader or user. Someone who is reasonably comfortable with the data and the comparison and the idea of shopping for care. So the Own Your Health site is meant to be much more basic and entry level, so to speak, for consumers. This is really a little bit more of a graduate level course, so to speak. However, we do want to make it as friendly as possible for consumers, and so the topics page allows consumers to get information about particular topics and then from there compare results. So we'll say we're choosing a condition and we're interested in low back pain. Just click on go. It will take us to some information about low back pain, but it'll also tell us what patients can do to take care of their own care, and also what their doctors should do so that they can be prepared when they go into the waiting room with a series of questions, but also with a series of expectations on what should happen. And then from there, they can click to see results for low back pain. One little fluke I will note here, and you will probably find this, is sometimes when you click on a dashboard like that, you have to select the measure that is pertinent. It will automatically default to an alphabetical listing in the database, which is an access measure. So just by clicking on that measure and selecting the one you want, you actually can get to what you need. And you can see what the results are. The About section of the website is information not just about the community checkup in general, but about our processes, our methodology, so that people can understand how we arrive at our results and why they should be considered trustworthy and objective. Um, you can also read more information about the state common measure set, what it is, how it was developed, how the measures are reported. There's a glossary of terms to explain 90th percentile and confidence interval to help people understand the terms that are embedded in the website. And this Need Help section provides a short video, just about 3 minutes, that explains how to use the website in much more abbreviated detail than I've been able to do, but just as a sort of a brief primer on the site itself, but also helping you to understand issues and address them as they come up. So if you don't see any data. So for example, when you're looking at hospital scores, you need to make sure that you're looking at all payer data, because hospital scores are not sorted by commercial or Medicaid. You need to make sure you have the correct year chosen, because measures change over time, and some results are not available for each year. Or you may actually have chosen something where there's just not any data available to report. When you're looking particularly at smaller organizations or smaller geographies, they do not meet the threshold for public reporting on a lot of measures. And so in those cases, you might be looking for data, but it comes up blank. So that is a really quick overview of the Community Checkup website. I think the best way to understand the site is actually to play with it, to spend some time on it, and particularly to spend time on the Compare Scores dashboard, so that you can interact with the data and see the different ways that you can actually arrange the data to display the information that you're specifically interested in seeing. There's nothing better than being hands-on to understand what is actually available to you. I'm happy to answer any questions that people may have now. I think I've answered the questions that people have typed in so far. This webinar has been recorded so that you can refer back to it, or if your colleagues were not able to attend, they can listen to the playback. It'll be posted on our website. I am also happy to answer questions offline. You can feel free to email me at jgallagher@wahealthalliance.org. I'm pausing to see if we have any additional questions. I do. Ask for my email address one more time. It is jgallagher, Gallagher, at wahealthalliance.org. And I'm happy to respond to your questions, and if it's a technical one, I will find the right person within the organization to answer it for you. I do have a question about, are we able to share tables to our e-files. And unfortunately, one of the limitations with Tableau is that you're not able to download or print. Uh, that is the way it's structured. We would certainly wish it were otherwise, but unfortunately at present, with the Tableau software, that functionality is not available. I have a question about the number of use in terms of number of lives in the state of Washington. We're drawing upon our database of which is from about 23 different data suppliers. It's the plans, it's Medicaid, and it's a number of self-funded purchasers. The database covers about 4 million enrollees in the state of Washington, so we're looking at north of 60%. The lives vary depending upon the measure. So for example, the diabetics measure would only include those people in the database who have been identified as having diabetes. Or if you're looking at sort of right now access to care, it would be those people in the database identified as being within that particular age range. So the number varies. It varies upon the measure involved. It's not a single overall measure, but the database as a whole covers about 4 million enrollees. Well, with that, I think we have reached the end of the line. If you do have questions, please feel free to call me, to email me. Happy to answer them. As I say, the webinar is recorded and will be available for people to view. So if you have colleagues who weren't able to make it, please feel free to pass that along. I will pass back the remaining 13 minutes to you as the gift of time, which is always the right size and the right color. Thank you very much for joining us today, and I look forward to seeing you at a future Alliance event. Thank you.